research topic, which is the effects on breastfeeding from maternal opiates in labor, which is a fentanyl through IV or epidural. So number one, I chose this topic because as a doula in the hospital previously, I have seen breastfeeding be compromised with almost every single epidural birth or IV with fentanyl. Typically, the mother cannot get the baby to latch postpartum due to drowsiness in the mom and the baby is not able to latch later on due to a delay in feeding, which is typically 24 hours later. This topic has a ton of evidence on the negative effects from fentanyl during labor on breastfeeding for infants and mothers. My other topic was the long-term effects mentally on baby boys for circumcision, but there honestly was not much evidence for that. So first, for my citation information, I got the first two from PubMed Central and the other ones from Evidence-Based Birth. For the first article, the purpose was to show the effects on breastfeeding from an epidural or an IV fentanyl, and the participants were 1,101 low-risk mothers, and the study design was a random double-blind controlled trial. Low-risk mothers at a full-term gestation and low/high dose of fentanyl was the study design, and for some reason my slide would not fully show the rest of the table, so I have to go back to the first slide. The data collection strategy was literature review synthesis, and the conclusion/results were opioids are linked to less successful breastfeeding, and the weaknesses for this was some texts were not updated and they were older, and the strengths is that it was a very large study, over 1,000 women. My second topic was from PubMed as well, and it was how statistically epidurals negatively affected breastfeeding. It was 1,204 women, and this was a prospective study, and it was an observational cohort, and it was from women who planned to breastfeed in mixed deliveries, vaginal C-section, and vacuum. And the data collection strategy was a prospective follow-up. 76.9% women were able to breastfeed exposed to fentanyl versus 84% were able to breastfeed not exposed to fentanyl, so it was a bit higher. The weaknesses is that the follow-up was limited to 6 weeks. I would like to see if this study goes further, like, months, maybe at the 6-month mark, to see what moms are exclusively breastfeeding still. And the strengths was that this was a very large study. Sorry, going back and forth on the slides. For my last topic, it was from Evidence-Based Birth, and this article showed more studies prove negative effects of an epidural. So multiple different studies for the participants. It was 100 mothers and 231 healthy low-risk newborns, 115 exposed to an epidural versus 160 not exposed, and a few others as well. It was a randomized double-blind controlled trial. This was for women planning to breastfeed and had previously breastfed and were planning an epidural as well. Back to slide 1. So the data collection strategy was that multiple studies were taken and summarized. This was not one single study. 12 out of the other 10 articles showed that epidurals in high doses were negative versus 10 of the articles were positive. So there was more negativity in the articles than there was positive out of the 12. The weaknesses were randomized and from different sources, which is kind of frustrating to work with when it's all over the place, but it did show a lot of inclusive types of studies. Some were from Norway, some were from other parts of Europe. It was all over the place. My next slide is, between all 3 articles, my synthesized finding is that fentanyl does correlate with lower breastfeeding success, and these are my resources. Thank you.